Welcome to this lesson on Standard Precautions and Personal Protective Equipment, or PPE. Standard precautions, also known as universal precautions, are a set of infection control practices used to prevent the spread of illness in any healthcare setting. These are applied to every client, regardless of whether they show signs of infection. Standard precautions assume that any blood, body fluids, except sweat, non-intact skin, or mucous membranes may carry harmful microorganisms, even if the client seems healthy. These precautions apply to blood, vomit, urine, stool, feces, mucous sputum, wound drainage. Always assume potential infection and follow standard procedures every time. When are standard precautions required? Standard precautions are required anytime there's a chance of contact with blood or bleeding wounds, vomiting or diarrhea, mucus or respiratory secretions, soiled clothing, linens, or equipment, medical sharps or injury risk, skin that is broken, peeling, or infected, clients with coughs, fevers, or known infections. This applies during changing linens, providing oral care, changing dressings, cleaning up spills or contaminated items, feeding or cleaning a client who is vomiting or has diarrhea. These precautions apply even when infection is not confirmed. Types of PPE. Personal protective equipment. PPE is used to create a physical barrier between you and any potential source of infection. It keeps microorganisms from reaching your skin, eyes, nose, mouth, and clothing. Common PPE includes gown, protects your clothes and skin from spills or splashes. Mask, covers your mouth and nose to prevent inhaling germs or spreading droplets. Goggles/face shield, protects eyes from sprays or splashes, e.g. during oral care or suctioning. When to use each type of PPE. Let's begin with the gown. When should it be worn? There's a chance your clothing may come into contact with body fluids, e.g. during diaper changes, wound care, vomiting episodes, assisting a client with diarrhea, incontinence, or open wounds, cleaning heavily soiled bedding or surfaces. Remove and discard the gown after each task or before moving to another room. Let's talk about when to wear a mask. The client has a cough, respiratory infection, or is under isolation precautions. Performing oral hygiene, tracheostomy care, or suctioning. There's a risk of splashes or sprays reaching your nose, mouth, vomiting, spitting, or respiratory droplets. A surgical mask is often enough. In rare, high-risk situations, special masks like N95s are used under RN agency guidance. When to use each type of PPE, goggles or face shield, providing care where splashes are likely, such as cleaning up vomit, suctioning a client, assisting with heavy coughing, providing oral or dental care. Goggles protect eyes from infection entry points. Viruses and bacteria can enter through mucous membranes. To use personal protective equipment correctly, there are a few essential rules you must always follow. Always put on PPE before contact with the client or contaminated surfaces. Remove PPE before leaving the client's room or space. Dispose of PPE in proper containers, biohazard bags if available. Never reuse disposable gowns or masks. Perform hand hygiene before and after using any PPE. Do not wear PPE in hallways or common areas unless instructed for isolation precautions. Let's take a look at some real-life situations you might face as a home health aide and the proper PPE to use in each case. If a client is coughing and producing mucus, wear a mask and possibly face shield. When assisting with changing an adult brief that has leaked onto bedding, use a gown and gloves. While performing oral care for a client with respiratory infection, you'll need a mask, gloves, and possibly goggles. If you're cleaning up vomit on the floor, wear a gown, mask, gloves, and face shield if splash risk. Always assess the situation and choose PPE that fully protects you from the specific risks involved in each task. Let's look at some common mistakes and why they're dangerous. Wearing a gown but not a mask during coughing care. This allows germs to enter through the nose or mouth, exposing you to respiratory infections. Reusing a mask between clients. This greatly increases the risk of cross-contamination. Wearing PPE for too long or outside the client area. This can spread germs to other areas or people, especially if the PPE is already contaminated. Not wearing eye protection during splash risk tasks. Eyes are highly vulnerable to infection through mucous membranes. Not changing gowns between tasks. Wearing through the transfer germs between surfaces or clients, defeating the purpose of infection control. Avoiding these errors is just as important as knowing when and how to use PPE. Safe care starts with smart, consistent practice. To wrap up this lesson, standard precautions apply to all clients regardless of diagnosis. Use PPE, masks, gowns, gloves, face shields when exposed to body fluids or respiratory droplets. Wear a mask during coughing, oral care, or exposure to respiratory secretions. Use a gown to protect against soiled clothing, linens, or splashes. Follow correct procedures for putting on and removing PPE. Proper PPE use helps prevent infection and protects both caregiver and client in the home setting. When you're ready, let's move on to the next lesson.